About 70 people of the over 39,000 at the Dzaipi Camp are testing for both HIV and Hepatitis B every day.
For Hepatitis B, at least out of 10, you get 1 or 2. But for HIV, you get sometimes probability is 1:20.
Most camps have an HIV test which automatically qualifies them to test for Hepatitis B, a liver-eating disease.
Hepatitis B is negative, this one is for HIV.
Those found with HIV are sent to the nearest health center 3, directly opposite the settlement. The same can't, however, be said of a disease similarly spread like HIV, Hepatitis B.
We have no treatment because the government is not providing the treatment, but we are now linking to the hospital to go and carry out a liver function, whether it is affected their liver or not.
The refugees who mostly test positive with Hepatitis B are aged between 13 to 19. Josephine Kapalanga is a health worker at Adjumani Hospital, which the people here do not have easy access to. It is about 17 kilometers away from here.
There is no transport there provided for them, so others are still have not yet gone for the liver function test up to now.
She and a few other health workers from the main hospital, as well as volunteers from the Red Cross, are here to reinforce the Dzaipi Health Center 3 team. But while Hepatitis B is easily accepted by many, HIV is not. Many still believe it is a disease for those with no morals.
Like there is one man whom I delivered the result 2 days ago. He became aggressive. He did not accept. He wanted to go and fight the wife, and up to now, he disappeared.
The health workers have told us that they have discovered that most of these people, especially the women, do not even know how HIV is spread.
Some have difficulty accepting the positive results.
Men tend to hide. For them, they say, no, for me, I have only one wife. How can I get the infection? Like right now, I've escorted 2 to be put on drugs.
Unfortunately, condoms that could be given out at this tasting point are not available.
We talked to Baylor. Baylor is planning. They communicated to Arua, so they are going to bring condoms.
These ones are finished. Stop it. The mother not yet tetanus.
Meanwhile, they've been carrying out immunization of what are mainly described as deadly diseases for the last couple of days.
The polio, measles, tetanus, diphtheria, DPC and DPT.
There is a lot of polio in South Sudan, and indeed polio kills like any other immunizable diseases. Now the Red Cross is working with Ministry of Health, the district authorities here, Office of the Prime Minister and UNHCR to see that we could immunize the children that are available. From our assessment, we noted that 70% of the refugees here are children and women.
Dr. Baguma, the Undersecretary from the Uganda Red Cross Society, says they expect more outbreaks.
Diarrheal diseases, which with such a population and congestion and the number of children would certainly spread very fast. And so to forestall that, we are currently with other partners trying to carry out sensitization of the community on hygiene, on sanitation, and also helping them to access safe water. The other likely outbreak in a situation like this one would be an outbreak of, say, measles.
This mother did make it out of South Sudan safe after delivering her twins in the bush. But for the 3-week-old babies, surviving the fighting in their country does not mean that they will easily survive any disease outbreak here in this thronged place.
And the plan that we have now, together with UNHCR and Office of the Prime Minister, is to congest the camp.
More worrying is the ease with which fecal matter is handled. When her child is done relieving himself, this lady picks him up and carries him back to what may be her home for only about 2 more weeks, as the camp will be closed when school starts. Florence Naluyimba, NTVUganda Camp in Adjumani District.